This is the MBA 215 assignment 1. First questions: what is the ACA? In March 2010, President Obama signed Comprehensive Health Reform, the Patient Protection and Affordable Care Action, is called ACA, into law. The law makes preventive care, including family planning and related service, more accessible and affordable for many Americans. Well, some provision of the law have already taken effect. Many more provision will be implemented in the coming years. The second, which is the ERICA, and when it is enacted, how does it related to the ACA? ERISA stands for the Employee Retirement Income Security Act. The act was enacted by the U.S. Congress in 1974 and applies to most insurance obtained as employee benefit from one employers. Employers are currently weighing the cost of ACA compliance against the risk and the cost of the religion. Their workforce to avoid maintenance. Any workforce realignment to reduce the number of employees working more than 30 hours per week may give rise to arguments that the employer specifically interfered with the right to benefit. Question 3. Why are employers moving toward using more part-time workers? And how does the increased use of part-time employees impact a company's profitability? What are some other advantages for the company, and what management problem will it cause? Moving toward using more part-time workers can keep more workers working per hour per week below the 30 hours per week, which can avoid offering them insurance or paying ACA penalties. The increased use of part-time employees will decrease the company's cost, so that increase the company's profit. Because the company doesn't need directly to cut workers' working hours, so the company can reduce the risk to violate the ERISA or the ACA whistleblowers prevention of both. But it may cause some problems, like high turnover rate, unclear workers' background, or not enough professional skills for the part-time workers, and so on. Number 4. What would a plaintiff fee to be required to prove in one of the cases, and what could employers use a defense? Are this type of case likely to succeed, or well, why not? A plaintiff must demonstrate an employee's intent to interfere with benefits in this case, and employer should try to demonstrate his decision is intended to minimize the business costs, not to block an employee from benefit. Both explanations should likely be true at the same time. It's hard to say if these cases are likely to succeed, because whether courts or some regulatory agencies will view the defense position as an acceptable rational for cutting workers' hours is unclear for now. The Department Lab of Labor of Labor hasn't issued any guidelines on the matter, nor does it plan to do so. Number 5. What strategies should you use to avoid legal challenge in these situations? Is a strategy of reducing hours an ethical one? Why or why not? Is your sister's strategy appropriate? Examine your sister's strategy from legal and ethical perspective. I have heard that if I would not be I have heard that I would not be subject to the ACA requirements if I reduced my employees' hours. So I would do that and hire some new part-time employees to cover the hours I reduce from others. The strategy of reducing hours is not an ethical one. Even though it may be legal, it still interferes an employee from benefit. My sister's strategy is just a joke, I think. Under the law, sorry, her strategy is okay because in Mexico they do not have this type of law. But under the ethical, her strategy will let about 100 people who are living in the United States lose their jobs. So it's not ethical. Is the ACC another example of unwarranted government insurance, intrusion into commercial affairs? No, it's not, and it is ethical. When people always work for a long time, there would some kinds of occupational sick happen, or ill happen. For example, when I was working for a company as an engineer, I had to work more than 8 hours every day with my computer. After the whole day, my eyes and my neck feel terrible. And I think the only salary for the work hours is not fair and not enough because my health must be damaged for the long career. So the ACC may help employees. Just I think need more perfect or better strategy of work hours per week, maybe of 40 hours, just a little bit higher than 30 hours will be better. Question 7. Select one developed country and summarize the healthcare system and select one developing nation. Summarize his healthcare system. Okay. Canada's national, I chose Canada, the developed country. Canada's national health insurance program often referred to as a medical, is designed to ensure that our citizens have response access to medically necessary hospital and physical service on a per paid basis. Instead of having a single national plan, they have a national program that is composed of 13 interlocking provinces and all of which share certain common features and basic standards of coverage. I have to say Canada's healthcare system is one of the best systems in the world and has a sound law system to protect it. It makes business be more ethical. The developed country is like China. The Chinese healthcare system is changing in response to the repeat changes in Chinese social and society as a whole. Preventive healthcare receive considerable attendance. It's believed to be cost-effective as well as health-promoting. Medical health care involves Western medicine, traditional Chinese medicine, and the combinations of the two. Fee-free patients and fee-paying patients have differing options in the system. Care options also vary between the cities and the countryside. The Chinese healthcare station is still very young. Most of the people who are living in the countryside are still not covered by this system, and they still need to pay a lot by themselves when they work in the city to make more money. They don't have the system to protect their health. For the employers, it's legal, but not ethical. Question 8. What additional information do you need to better answer these questions, and what other legal and ethical issues do you see in this narrative? Some other developed countries' healthcare system would be needed to compare with the ACA. That may make me better answer these questions. And I have had little need. What other legal and ethical issues I see is that I used I instead of the lady. I have had the little need to fire employees. Several years ago, during a particular business time, I skipped the usual hiring process and hired 4 relatives to work for me. What I didn't know was that 2 of them had criminal records, both for Medicare fraud. One juror was also convicted of wire and computer fraud, but they still work for me, although I have had reservations about their answering the phone. Thank you.